Hi, this is Diana, and I'm going to go ahead and talk to you about the physiological status of patients and also the different parameters that tell us the depth that the patient is under when they're under anesthesia. So the physiological status of a patient means whether they are oxygenating and making sure that their blood is circulating, heart is pumping, this kind of thing. There's several things that we monitor when we're looking at that. We're looking at the heart rate, the heart rhythm, the respiration rate, the respiration rhythm, temperature, the capillary refill time, the mucous membrane color, temperature, blood pressure. All of these things can tell us how a patient is doing under anesthesia and if everything is functioning as it should when they're under anesthesia. So monitoring the heart rate and the heart rate rhythm is very important. It tells us the overall status of the circulation, how the heart is pumping. We want it pumping at a good, strong, a good steady rate and a good steady rhythm. We want to make sure it's not too fast, not too slow. We want to make sure it's beating adequately to move oxygenated blood through the tissues and to other parts of the body. That's really, really important when they're under anesthesia. A normal heart rate for a dog, we're looking at 60 to 150 beats per minute, and a cat, 120 to 180 beats per minute. During an anesthetic procedure, the heart rate can decrease. This can be due to the drugs that we use. It also can be used, can be caused by blood loss. It can also increase while we're doing an anesthetic procedure if they're feeling pain or stimulation. So the heart rate can be monitored using different things. An ECG machine, which is using the leads. We are looking for arrhythmias, defibs, anything like this, anything abnormal that we are looking at in the conduction system. You can use your stethoscope to listen to the patient's heart. That's always good. You can use an esophageal stethoscope also. We're looking for anything like a heart block, which is important. Any of those things that need to be corrected right away during the anesthesia procedure. Also using the ECGs, we are looking for a P wave for every Q. We're looking for a P wave for every QRS complex. So that would tell us if something was going on different too. So using your stethoscope, using these things can give us a good idea of the heart, how the heart is pumping, if it's a good steady rate, beating correctly. The other things that we look for when we're doing this, mucous membrane color. This is looking at the lips and the gums. We want them pink. This tells us that the patient is oxygenating properly, like they should be. If they weren't getting enough oxygen, the lips and the tongue would be turning blue and white. That tells us that there is something going on that we need to correct right away, that they're not getting enough oxygen. So checking the lips and the tongue is very important. Another important factor is the CRT, which is the capillary refill time. How we check this is we lift up the lip, we press on the gum at a moderate pressure, and we watch it turn white. But when we lift our finger off, the time that it takes to return to pink is telling us the capillary refill time. This is an indicator of the perfusion. We want to make sure that that is turning pink within 2 seconds. If the blood pressure was to go down, the capillary refill time would increase. That means that there's something going on, that the patient isn't getting enough oxygen. They're not getting enough to move oxygen to the blood, to the other limbs of their body, other organs that they need to get to. So that's important that we do this. Talking about blood pressure, we have our little machine here. We have blood pressure cuffs that we put on, and this is an indication of perfusion. We want a strong blood pressure. Anything below 60 milliliters of mercury indicates a decreased flow to organs, and we need to correct that right away. A lot of anesthetic agents can decrease the blood pressure under anesthesia, so it's always a good idea to take a baseline blood pressure prior to giving any anesthetic drugs to a patient, so you know prior to it what their baseline is, because like I said, drugs can, any of the drugs that we use can drop the blood pressure. Respiration's important. It's telling us that the patient is maintaining ventilation. It's also how they get their oxygen and inhalant drugs is through their respirations. If the patient isn't breathing and they're not getting enough O2, which means they're not getting enough oxygenated blood to all the different tissues in their body, and this can affect the nervous system or the nervous function. This can result in death if the respirations are compromised in any way, such as if there's an airway block or going on. So you can watch how a patient is breathing. You can watch their chest rise and fall. You can watch the reservoir bag also, or also the intake and exhale intakes on the machine can tell us, make sure that they're breathing. A normal dog and cat respirations during anesthetic procedures, we want to between 8 and 20. When they're at a good surgical plane, they're taking deep, smooth breaths. They should be bringing in as much oxygen as they can, and we want them exhaling carbon dioxide, which we can monitor through a capnograph. We use the EMMA here, so our machine here does have the function to do a main line or a side stream capnograph, and if we were to use that, we would see a waveform across our monitor, meaning that when the patient exhales, it would go up. That means they're exhaling CO2, and when they inhale, it would come back down because they're breathing in oxygen. So it would give us a waveform across our monitor here for that, but we use the EMMA here that gives us respirations and CO2. Temperature is important. An open body cavity and can drop the temperature. Drugs can drop the temperature. And any decrease in the body temperature can cause a decrease in the central nervous system. So we want a body temperature around 98 to 100. Hypothermic animals don't metabolize the drugs that we give them quite as easy. So our table is heated. We have a heated table, which helps us. You can use bear huggers. You can use warm blankets. We also have fluid bags that we put in the microwave to warm up. We have another type of warmer that's out there that we use for dentals, that once the patient is placed on it, the heat starts, so it keeps them warm. So anything that you can do to keep a patient warm. We also have an egg. I don't know where our egg is, but you hook the IV fluid through it, and so when it pumps into the body, it's warming up the IV fluid that's coming from their bag to keep them warm. Excuse me. I'm gonna have to go get a drink here. I'm losing my voice, and then I'm going to discuss the different planes of surgical planes and stages of anesthesia. Okay, after all the physiological parameters that we monitor here, going into anesthesia, I'm going to discuss the different stages and planes of anesthesia. There are 3 stages. Stage 1 is the patient is sedated, but he's alert. You will see an increase in the heart rate, increase in respirations. They may be panting a lot. And then into stage 2, at this time, we'll see the vocalizations, paddling, respirations will be irregular, increase of the heart rate still. The goal is to get them from stage 2, to get them through stage 2 and into stage 3, plane 1 of anesthetic procedures. In stage 3, plane 1, the patient is unconscious. The heart rate is regular. It's at a normal rate. The pulse is strong and normal. at a normal rate. Then we're into stage 2, which is stage 3, plane 2, which is the surgical plane. This is where the patient is unconscious. The heart rate is moderate. The respirations may be shallow, but at a moderate rate. Everything is going great. This is where you can do your surgery. From this point, the patient, if you're not monitoring carefully, can enter stage 3, plane 3. This is a very deep anesthesia phase. The respirations are getting shallow, the heart rate is low, capillary refill time is increased. This is where you start entering kind of the dangerous phase, because they can go into stage 3, plane 4 very quickly from this point. In this stage, respirations are erratic, heart rate is below normal, you got a really long, prolonged CRT time, mucous membranes are pale, the patient is starting to lose the ability to perfuse oxygen properly. At this stage, if things aren't corrected quickly, the patient is going to die, because we're going to enter stage 4, which is the stage you do not want to be in. The patient isn't breathing, cardiovascular collapse happens very quickly. Actually, the heart rate will stop. This is a stage you do not want to get to ever. So, monitoring the physiological parameters along with the reflexes I'm going to talk about every 5 minutes is how we make sure that anesthesia procedures for our patients are done safely. This is why doing an anesthetic chart, monitoring every 5 minutes is very important. Other than the every 5 minutes, making sure you can have a stethoscope on, listening to heart rates, just watching everything. Don't ever let your attention wander when you're in surgery. Things can go bad very quickly, and you just don't want that. Very important. Stay alert, stay with it, monitor constantly, hands on patients, everything will go great. Now, some of the reflexes that we see during the anesthetic procedures prior to inducing and everything are several. A reflex is an unconscious response to a stimulus. So meaning that when we give some drugs or when we try to do something to one of the patients, we'll see a reflex in one of their, with something on them, such as the swallow reflex. This is seen during very light stages of anesthesia. This is a good indicator of when you want to remove your ET tube, is when you keep it in until they have that swallow reflex back, and then you know it's safe to remove the tube. Another reflex we see or use during anesthetic procedures is the laryngeal reflex. This happens when anything that you try to put down the throat touches the epiglottis, such as trying to tube them. It closes, and this protects the patients from any tracheal aspirations. So you'll see that it's really fun trying to tube a cat. Once you touch that, everything shuts up, and we call it trying to play the shooting game, getting that tube down in a cat's throat. So you see this in really light stages of anesthesia. Another reflex we monitor is the palpal reflex. You do this by touching the inner medial canthus of the eye. And when you touch this, if the patient is still a light plane of anesthetic, they'll blink. When they're under a deeper level of anesthesia, they won't blink when you touch the medial canthus of the eye. There will be no reflex with that. Another reflex that we use, and this one we use when we do mass conduction on a patient, is the pedal reflex. This is tested by squeezing a toe on a patient. When you squeeze a toe, if they pull their foot back, it means that they're still in a very light anesthetic. When they're in a deeper anesthetic, if you pinch their toe, you're not going to get that pull back effect. And we use this during mass conductions. Another one that we use, jaw tone. The jaw tone, really important when you're trying to tube a patient. When when they're awake, they have all their muscle control. So if you try to open their jaw, they're not going to allow you to do that. As they get into a deeper plane of anesthesia, they will allow you to open their jaw. This is a good indicator when we can actually tube a patient, is when we have the ability to open their jaw. Another one is the coronal reflex. This is mostly used in large animal anesthesia. In small animals, what you're going to see is so slight you really kind of miss it. What happens is you take a drop of sterile saline and you drop it in the eye. And when this happens, the eye will pull back. In a small animal, the reflex is so subtle, it's really hard to see. So this is mostly used during large animal anesthetics. Another reflex is the ear tick reflex. This happens when you touch the inner ear, just lightly, little hairs inside their ears. When you do this, the ear will twitch. Lighter stages, it will twitch. During deeper stages of anesthesia, it won't flicker. Another one, the eye position in anesthesia. It will change from central to ventral medial, meaning that the eyes will roll towards the nose, or down, looking at the chin. They'll start looking at the chin. And small animals during light anesthesia, the eyes will still be central. As they start entering the medium and deeper anesthesia, their eyes will turn ventral medial, meaning that they'll go down looking towards the chin area. Another one we can monitor reflex is respiration pattern reflex. They'll be irregular during lighter stages of anesthesia, and they'll smooth out during deeper stages of anesthesia. So you'll start seeing them taking nice deep breaths. So taking in all of the reflexes, the physiological statuses of the patient, taking all of this into consideration, make sure that we have a very safe anesthetic procedures. There's no complications. Anything that you do come across, it's best to bring to the surgeon right away and let them get that corrected. So the patient comes out of anesthesia alive, happy, well, and they go home to their owners at the end of the day. So that is my little discussion on this.